So in my first folder, I have chart review. Within this, I have the EOP chart review assignment, as well as the preparing for patient care and student document. And that talks about interprofessional communication. So that's why that's in chart review. And then I have consent, and that just is our informed consent PowerPoint. Following this, I have equipment, and in my equipment file, I have the physical therapy equipment PowerPoint that we have. Following that, I have a finances file, and this has 8-minute rule reference chart, the APTA pocket guide, the ICD-10 cheat code, as well as different service codes. Then I have a flag and lab value file. I felt like these two went together well. So I have interpreting lab value student, the lab value liver glucose and blood gases, lab values, RBC lab value, red and yellow flag interpreting diagnostics, the red and yellow flag document, as well as the vital sign answer sheet. Following that file, I have goal writing, which just has our goal writing lab and our PowerPoint. After that, I have a HIPAA file. Within this, I have the HIPAA PowerPoint that we had in class. Following this, I had pain tests, so I had all our different pain tests as well as some scales, so the Borg and Braden scale, and then checklist for nonverbal pain indicators, PAS, PDI, short for McGill and VAS. After pain tests, I'd have patient interview, which has an eval form and intake form, as well as our PowerPoint going over patient interviews. Following this, I have peripheral pulse file, which has cardiopulmonary test measures, as well as the peripheral circulation lab answer sheet. After this, I have a file for SOAP notes, which has introduction documentation, as well as our SOAP note worksheet with answers in it. Then I have standard precautions, where I just have standard precaution for dressing, as well as our PowerPoint. And then I have a systems review file, which has cardiopulmonary test and measure, EOP, chart review, as well as systems review student PowerPoint. And then within this, I have one for skin, which has our skin integrity